Molina prior authorization for addiction treatment is required for residential, partial hospitalization, and intensive services. Skip it, and the claim comes back denied. When a Molina prior authorization is required, and you don't obtain it, the service is rendered, but the claim does not get paid. Molina prior authorization for addiction treatment. Here is what your billing team needs to know: when it's required, the tools to check, and where to submit. We cover when Molina requires a prior authorization, the LookUp tool that confirms it, and the portal where you submit the request. A prior authorization is formally asking Molina for permission to provide a service in response to a diagnosis code. Precertification, pre-authorization, predetermination, prior approval. Molina prefers the term prior authorization, and the concept is the same. On receiving the request, Molina determines whether the service is medically necessary and whether the member's plan covers it. After review, Molina either issues an authorization or a denial. Miss a required prior authorization on a residential or PHP stay, and the work is done with nothing to bill against. Members may appeal a Molina denial, but an appeal is added work and lost time, none of it guaranteed to overturn the decision. Obtaining prior authorizations with Molina can be an expensive time waster for busy addiction treatment centers and providers. Behave Health's RCM service is built only for behavioral health providers, not healthcare generalists, and is designed to support every step of your Molina prior authorization work. Behave Health is not a healthcare generalist. The RCM team works only for behavioral health providers like you. The team carries strong working relationships with every major insurance company in the United States. Not every behavioral health service triggers a Molina prior authorization, but 3 addiction treatment levels of care always do. Here they are. At publication, Molina did not require a PA simply to begin services with an in-network behavioral health provider. PA rules change. Verify current requirements with Molina. 1. Molina requires a prior authorization for all behavioral health intensive services. Any service Molina classifies as a behavioral health intensive service requires a prior authorization before you provide it. 2. Molina requires a prior authorization for all behavioral health partial hospitalization programs. Every partial hospitalization program admission needs a Molina prior authorization on file before services begin. 3. Molina requires a prior authorization for all residential addiction treatment programs. Residential addiction treatment programs always require a Molina prior authorization, the highest acuity, highest cost stays you bill. If you're not sure a PA is required, Molina's online prior authorization LookUp tool confirms it. But only for outpatient services, not inpatient. To search, you need the member's state and the specific name of the member's Molina plan. You also need the line of business the member's plan runs through: Medicare, Medicaid, or Marketplace, and the relevant CPT or HCPCS code for the proposed treatment. The tool covers outpatient only. It can't confirm inpatient. Molina is moving its billing business to Availity, so that's where your prior authorization work happens now. Register with Availity if you haven't. Then log into the Availity provider portal to complete a PA or any other billing work with Molina. Prefer paper? Molina's request prior authorization form is a downloadable PDF you can fill out and submit without touching Availity. Behave Health's revenue cycle management service gives hands-on attention to every component of your addiction treatment billing, so PA work stops eating your team's hours. The RCM team handles verification of benefits and utilization review, the front-end checks that set up a clean Molina prior authorization. It also covers billing and collections and patient responsibility across the full revenue cycle. And when Molina issues a denial, the team manages the denials and appeals follow-up so the work doesn't sit. Stop letting Molina prior authorizations waste your team's hours. Book a 20-minute demo of Behavioral Health RCM at behavehealth.com. See Behavioral Health Only RCM, VOB, Utilization Review, Denials and Appeals, built for addiction treatment at behavehealth.com.